So cancers major, and this is cancer whether in male or female or in different parts of, but most of its cancers, the causes are not known. So people who are obese are the higher stand the higher risk of developing breast cancer. So for breast cancer, it's early detection. And what that means is before it used to be encouraged women to check their breast. We call it breast self-exam, BSU. But things are even changing now. It's now called breast awareness. Contraceptive use can also increase the likelihood of breast cancer.
Said what? Please.
Condom is a contraceptive. It's not linked to breast cancer.
Episode of the Happy Family Podcast. All right. In this season 3, we have been talking about health-related topics. You remember the theme, health is wealth. All right. I'm not here alone. I'm in the company of a family member and a very important guest to help us dissect a very special topic, a topic that affects every family. All right. So my name is Dr. Shino Alade Jubelo, and I'm in the company of my family member, Olabisi.
Thank you. Good morning. You already mentioned my name. My name remains Olabisi, and I hope we are going to have a really enjoyable time today in the studio.
Yes, indeed. Well, enjoyable is relative because it depends on what you are talking about. There are some things that are educative, soul touching, but then it does not make you smile. Let's hope this is going to make us smile.
Let's hope. When you are learning sometimes, you tend to enjoy it. Like you don't know some things about some things, and you see somebody that wants to come and teach you, something you...
Indeed,
Yeah.
if you appreciate knowledge.
Yes.
In any case, any knowledge about health, that's knowledge about life.
Yes.
And it's
so
very
important.
Important to
So
every one of
important,
us.
yes.
All right. Today in the studio, we have a medical doctor in our midst. A medical doctor of 10 years, an expert in public health related topics. We have Dr. Sheo Ajibawo. Today we are talking about prevention of common cancers in women. Prevention of common cancers in women. Doctor, in the past couple of years, thanks to the information availability these days, we have our phones and everything. But we hear of this person has died of cancer, that person has died of cancer, and all of that. But today we are looking at how it affects women. Why do we have a lot of cancers affecting women? Is it that it has increased over the years, or there is something else that we need to watch out for?
Thank you very much, Doctor. I'm very happy to be here today. So to answer your question, I think there are two major factors responsible for an increase in the observation of cancers in women.
Oh, observation.
Yes, we see more cancers. One of it is because, we're a more enlightened society. So in the days of our parents, there was cancer, but they didn't know it as cancer. Yeah. So the science has evolved, medicine is not left out. So people are understanding and saying, no, this is cancer. So that's one other reason why cancer is on the rise. Other things could include lifestyle. Lifestyle has changed.
I was going to come in, it comes to that because people believe that our parents were eating vegetables, fresh ones, so they lived longer and they didn't see all these cancers. Is it really true?
Our parents are getting to know now that, okay, this person died, in 19 something, this person died. Oh, we are just seeing that the person died of cancer because they've seen similar issue. I think now they are now more enlightened because of science and, like you say.
Yes, you also talked about the lifestyle change.
Yes, lifestyle is changing so rapidly. Back in the days, I'm still a young woman, but then in the, let's say, the good old days or in the olden days, people ate more food that were less processed. It was more of farm to table with minimal preparations. People exercised, and it wasn't about jogging, but they wake up in the morning, they'll have to walk all the way to the farm.
We have cars now.
Yes, and it's so funny. Some people would not even in areas where bikes are available, they would want the bike to drop them right in front of the door. So people would do, if it's possible for the bike to drive into the living room and then they pay the bike back, people would actually do that. So lifestyle is changing, things are evolving. So I believe all of these things have a role to play in the increase. We call it incidence. That's the number of cancers, the number of cancers. Yes, the incidence of cancers.
So we have better records today. We can really tell today that this person had cancer. We didn't have access to this type of information. So we cannot readily compare like we had more now or back then. We can't say.
So again, yes, we cannot say that. Or do I say no? We cannot say that in those terms. The thing is, the detection of these cancers has become easier. So if before I didn't know how to detect, let me use a common example. If I didn't know how to detect for, let's say, a house fly in this room, in this studio, for example, it doesn't matter if there are 100 flies. So long as I cannot detect or I cannot see them, then I'll say, it's 0. But at the moment I get maybe an instrument or something that can sense a fly, and then it goes to 100. Doesn't mean that there were no flies in that room. Not necessarily. But it could just mean that, I'm able to detect that there are more flies. However, science has also told us that the rates of cancer are rising. That's rising. It's on the increase.
Wow.
And you can even testify that you go to church and sometimes you hear people say, when I was a younger child, I didn't used to hear people give testimonies of, I had cancer, but now I'm free. But these days, almost every month, you're hearing, I had cancer. And so that's again, two things, the same two things we have been saying. Now people can detect these cancers. And then again, lifestyle and a whole lot of things have changed.
So what are the common cancers in women?
Yeah, thank you. So in women, common cancers are breast cancer or cancer of the breast, cancer of the cervix or cervical cancer, and then colorectal cancer. Those are some of.
I've had breast cancer, I've had cervical cancer, but I've not had the last two.
Colorectal. If you can just explain each of them, starting from the colorectal.
Colorectal, it's two words combined into one. Colon and rectum. So both the colon and the rectum are parts of the intestine. So in other words, we're saying cancers affecting the large intestine. There are two parts of the intestine. There's the small and the large. So colorectal just means cancer of the large intestine.
Okay.
Cervical cancer, it's cancer of the cervix. Now the cervix is a part of the womb, or in medicine it's called uterus. It's a part of the womb, and it's only women that have lungs. So men are exempted from cervical cancers.
Yeah, we have our own.
So men are exempt from cervical cancer. So it just means cancer of the cervix. Then breast. Everybody has a breast. And I want to also say that even though we're focusing on women's health today,
yes,
breast cancer can also affect men.
Hey, don't say that. I don't want to hear. I have never had that one before. It's not happening.
However, it's just in 1% of 1%
What?
breast cancers that occur in men. The 99 is in women.
So the breast cancer, the cervical cancer, and the colorectal cancer. So what really are the causes of this cancer in women?
So I think to help them understand and take it one after another, though there are some factors that will cut across all three. So for cancers, major, and this is cancer whether in male or female or in different parts of, but most of its cancers, the causes are not known. However, there are things that are called risk factors. What risk factors simply mean is in individuals who have that particular factor, or in who have that particular factor, or who have that particular condition, science has found out that there is an increased likelihood of coming down with cancer. It doesn't mean that if an individual has that risk factor, then it's 100% guaranteed that the person is going to have cancer. No. It just means likelihood, association. And then there are some other individuals, on the other hand, who do not even have those risk factors, yet still come down with cancer. Yes. So to answer your question, let's start with breast cancer.
Okay.
So there are factors that are, let me break it down so that we can understand easily. There are non-modifiable factors and modifiable. It's English. What that means is non-modifiable. You cannot change it. Modifiable means change. There's nothing you can do about it. So example of non-modifiable risk factors would be age. No matter what you do, even if you use serum on your face and you use all of the makeup and everything, you are getting older by the day. And there are cancers that are commoner in older people in certain age. So breast cancer is commoner in older people. So say 40 years. The books say 40 years, 55 years.
Why is that? Why is that? Is it because they are not as active as they were in their youthful age, or what?
So again, breast cancer, the causes are not clearly. However, we have seen from practice. I've had 2 patients who had breast cancer and they were in their 30s. Unfortunately, one of them passed. Yes, so I can't. The other one, she moved on to a different facility. So it's getting commoner even in younger ages. So age is a risk factor for cancer generally. For breast cancer, age, gender. I mentioned earlier that 99% of breast cancer cases occur in women and 1% in men. So that means that if you're a female, there is a high likelihood of getting breast cancer. Now, then family history. A woman who has whose mom or grandmom had breast cancer is at a higher yes, thank you. He's at a higher risk of developing breast cancer. So those are some of the non-modifiable factors. You can't change your family, you can't change where you're born or who you're born to. However, there are other factors that are non-modifiable, meaning things you can do something about. So things like obesity. People who are found to be obese just means that the person's weight is more than normal for their height. So people who are obese are the higher, stand the higher risk of developing breast cancer. People who smoke cigarettes or who inhale, they are passive smokers.
Yeah.
They don't smoke, but then they continually stay in areas where cigarettes is being smoked. They are also at risk. Alcohol consumption also increases the likelihood of breast cancer. And so those are contraceptive use can also increase the likelihood of breast cancer.
Said what? Please come again.
Again, some of these things are not they are not etched in stone. Would you say a woman should use contraceptives? However, some studies have found that contraceptive use, and then contraceptives are in different types. There are some that are hormonal. Condom is a contraceptive. It's not linked to breast cancer. So it depends on the kind of contraceptive. So those are some of the risk factors for breast cancer. Cervical cancer, on the other hand, again, modifiable and non-modifiable. Cervical cancer is common in women aged maybe 55 years and above. Yes, it's a slow-growing cancer, so 55 years and above. And then again, it can happen in a man. It's limited to women. So those are some of the non-modifiable factors. However, the modifiable ones are increased early age of first sexual activity. So this is where, by that I mean, people who just start to have sex early. What that means is it predisposes them. But I have to talk about pause for a moment here in talking about cervical cancer. This is one of the cancers that, by God's grace, medicine has found the cause for. In over 90% of people with cervical cancer, an organism called HPV. HPV human papillomavirus has been detected. So what that means is most times, if you have 100 women who have cervical cancer, over 90% of them will have that virus in their cervix. So that's one of the cancers that,
Is it sexually transmitted?
yes, it is sexually transmitted. So that's why age at first sexual intercourse.
So men do carry this
Yes.
virus as well.
Thank you. Men can transmit this virus. Then people who have multiple sexual partners, partner A today, partner B tomorrow, they're exposing their cervix to different partners. So yes, so that can also be that can, in fact, that can increase the risk of cervical cancer. Colorectal cancer, on the other hand, again, age. But then in colorectal cancer, you also have things like diet. So it has been found, again, not to say that everybody who does this or who doesn't do it will have cancer, but it's been found that people who eat, whose diet is composed of mainly ultra-processed foods that have been really processed over and over again, they are found to be at a higher risk of having cancer. And people whose diet is low in fiber are also at increased risk of having colorectal cancer.
So you said colorectal cancer. How is it different from cancer of the colon?
It's the same thing.
Okay, so men do have
Yes.
you didn't mention that because is it that it's more prevalent in women than men or what?
It's one of the, it occurs in both gender.
Yeah.
So I think it's the commonest. Again, when we're talking about cancer, we have to identify it based on origin. I mean, what is commoner in Black women is not, what is the most common cancer in Black women is not the most common cancer maybe in Caucasians. So, but in both gender, male and female, colorectal cancer is maybe number 3.
Wow.
Yes. Again, depending on the part of the world that you're looking at.
Okay.
So for the breast cancer, what are some things women can do to actually prevent breast cancer?
Again, because we do not know the exact thing that is causing breast cancer. Prevention for most cancers would focus mainly on early detection.
So I came across something called the word carcinogenic substances. So, and dictionary definition says that these are things that are likely to cause cancer. Can you enlighten us on that?
Well, yes. So carcinogenic just means substances that, like you rightly said, sir, substances that can cause cancer. But thanks to there are different carcinogenic substances have been found, can be linked to different cancer types. Yes. So thalidomide, which is a medication that was given in the, let's say, olden days, was implicated in some form of cancer. But then again, because of the advent of science, that drug is no longer given, no longer administered. So we can breathe self-release. So they're just, it's because as science evolves, we're able to pick and say, this can cause cancer.
Yes, for example, I saw things like some metals, exposure to some kind of metals. There was a case in the United States a few years ago of a guy who used to work in a company where he sprayed a particular type of pesticide. And after some years, he developed cancer. And they realized that a number of people using that pesticide developed the same. And they said it was actually a result of a metallic substance that predisposed them to the cancer type. So there are things like that.
Yes.
Okay, I even saw something like tobacco.
Yes. Tobacco, that's indicated in lung cancer.
Lung
Cancer of the lung. But then again, it's prevalent in a lot of cancer. I mentioned it earlier when I talked about breast cancer.
Smoking,
yes, that's tobacco.
Because when it comes to smoking, there are different kind of things that people smoke. They smoke electronic cigarettes, tobacco, cigarettes, and so on. So they all predispose to cancer. Wow.
So smoking is inhaling smoke, right? Like, what about people that are doing firewood job? Does that mean they can be exposed to cancer?
Well, anybody can be exposed. Like I said earlier, risk factors. However, For lung cancer, now we're talking about inhaling, it's more of tobacco. People who use firewood, they can have lung diseases. And then again, when the lung diseases, maybe by one pathway or the other, maybe eventually cancer, but it's not the straight pathway it's for tobacco. And for lung cancer, I beg your pardon, it's more of tobacco.
But what about the smoke that comes out of the exhaust? Car exhaust and industrial smokes and all that.
Yes. Again, that can predispose to lung diseases.
Okay.
The thing about cancer is it's like an injury to the cells. So anything that can predispose that, maybe by one pathway or the other, if other risk factors are present, we eventually lead to cancer. However, all of this smoke that we're talking about, more of lung diseases. Even back in the days, I remember when I was a child, the ceiling in the house was made of asbestos.
Yes.
So there's a lung disease called asbestosis.
Asbestos.
Yeah, so that's lung disease gotten because of asbestos. Thanks to knowledge and science, we don't have asbestos in most houses anymore. Yeah, so
Wow.
Thank you, doctor. So how can women prevent breast cancer?
Yeah, thank you for the question. So prevention of breast cancer, since we do not know exactly what causes it, prevention we'll start with lifestyle factors, modifiable, what you can change. You can't change age, you can't change who you're born to, but you can do something about your diet. So eating foods that are rich in fiber, foods rich in fiber could help. Keeping a healthy weight, because we mentioned that obesity could be a risk factor. However, having said all that, we know that these are just general things. They aim for healthy living, not just peculiar to cancer. For breast cancer, the thing is early detection. In fact, I dare say for virtually every kind of cancer, it's going to be early detection. So how can women detect these cancers early? Now, before I go into that, I want to say that most cancers have a higher or a better outcome if they are detected early enough. So for breast cancer, it's early detection. And what that means is, before it used to be encouraged women to check their breast. We call it breast self-exam, BSE. But things are even changing now. It's now called breast awareness. What that means is a woman is encouraged to be familiar with her breasts, because part of the symptoms of the signs of breast cancer would be maybe a lump in the breast. Sometimes it may not even be a lump like that, but it may just be that there's a change in the way the breast looks, or the way the breast feels, or the size. So it's been encouraged that women are aware of their breasts, so that at the slightest change, they're able to present to a health facility to say, oh, something doesn't just feel right. I don't know what it is, but something doesn't just feel right. Yes.
Okay, so I also heard that breastfeeding exclusively can actually prevent breast cancer in women. Is that true?
Yes, it does reduce the risk of.
And I have a question, which is there a correlation between what is it called? This women have fibroid cancer, and I've had someone say that their fibroid became cancerous, something like that.
That's for prevention of breast cancer. So let's talk about cervical cancer. When I was talking about the risk factors for cervical cancer, I mentioned that human papillomavirus, as HPV, it has been found to be a cause of cervical cancer. So thanks to the Nigerian government and several partners, there is a vaccine. Well, the vaccine has been in existence before now, but now it's been, I think it was made available in Nigeria for everyone.
For free?
Yes.
For free?
Yes. That was sometime last year. Oh, yes. So there's a vaccine that can prevent infection with HPV. So that's the human papillomavirus. So it's given to school-age children. I think it was when the first step came out, it was given to children between the ages of 9 and 14. Yeah. However, in more developed climes, and they're also giving it to the males, because we know that males carry this virus, so that they don't give the females. I think for now, we're still in Nigeria, we're still focusing on breastfeeding.
Yes, let me take the
Person focusing on giving school-aged girls. So that's one way to prevent cervical cancer. Take your children for the vaccine. And even women who are older and have not had sex, who have not been sexually exposed, can still take the vaccine. However, it's always better to take it before the first sexual exposure. And that's one way to prevent cervical cancer. Then detection of cervical cancer. Again, I mentioned that early detections can save life. There's something called screening. Screening just means you're checking healthy population for who might be at risk for a particular condition. You're checking them to see if they have the condition or they have the early signs, the telltale signs of the condition. So for cervical cancer, it's a slow-growing cancer, and when the cervix is checked before the cancer develops, there are some things that they call them pre-cancer lesions or precancerous lesions that will tell the health worker or whoever is attending that, oh, this is not cancer yet, but if left untreated or unchecked, in the next couple of years, it can progress to cancer. Yes, so there are various ways by which the cancer can be checked. So let me just start from, let's say, simple to more complex. So there's something called VIA. VIA just means visual inspection under acetic acid. In simple terms, it means that a woman will go to the hospital or a health facility and then they spray acetic acid or vinegar into the cervix. Just spray it. And within a minute, if there are precancerous lesions, the cervix will change color. But the areas where, I'm not saying the entire cervix, the areas where there are precancerous lesions will change. They becomes whitish. So when this happens, the health worker can say, oh, madam, you need to go for further screening. And these tests are available in health centers. You don't even have to, in private hospitals and for free. So it's not for free. Some people run it for free when they have programs. But I know that one house facility that I used to charge 3,000 naira. But some governments, I think, on those state government, I don't know if it's still ongoing, did it for free at some point, but it's not very expensive. But the next test will be something called a pap smear, PAP, the pap Papa smear. Now, this is a more objective test, where it involves taking a sample of the cervix. They just use something like the cotton bud you used to clean the ears or a small brush to just take a sample of the cervix, take it to the lab, and look under the microscope.
Wait,
Yes, ma'am.
they will cut the
Not
cervix.
cut. That's why I said something like a cotton board, or imagine your toothbrush, something like a toothbrush. So the woman will lie down and then open her legs like she wants to give birth.
Okay.
And then they just put the stick in the brush and they just swipe. It's just a bad word.
That's
The cervix. The cervix is a hollow organ.
Yeah.
So assuming this is the brush I want to use and this is the cervix, just swipe. I'm not cutting. It's not. It's just uncomfortable. It's not a painful procedure.
Oh.
Yes. So they take it to the lab and then look under the microscope. This is a more objective test. Because now we're going to look through the microscope. The first one, the VIA, is more subjective. I may see something while you may not see something, and he may see something. So, but then in resource poor areas like our country where people don't have the funds to do a pap smear, this is a good way. The pap smear would cost about 25,000 on average. It could be more, it could be less, but about 25,000.
It's more expensive to use a line. So the cervical cancer vaccination, you said sometime last year it was available free of charge. Is it still available free of charge? Otherwise, how expensive is it?